talk a little bit about the subject of arthritis in our pets. It's actually something that's much more common than you think it is. You'd be surprised how much we can actually help them continue to be that sort of young puppy or kitten that you have had for so long, but seems to be slowing down a little bit. Just some things to think about the next time you come in for an exam with your dog or your cat that you may want to ask questions to your doctor about to consider with arthritis. In most cases, any dog over about the age of 5 to 8 years old has some form of arthritis. So what does that mean? It doesn't mean that they have a specific disease that we're going to be panicked about, but it does mean that there's starting to be some changes in the joint itself. The most common joints that we see this in are knees, elbows, and hips. We can see it in their back too. Oftentimes that's in the long breeds, such as the Basset Hounds, the Dachshunds, the breeds that have less stability in the center of their bodies. But it's not as common to see that as it is to see it in the smaller joints that are holding up their weight all the time. So a normal joint for these guys is usually very rounded and doesn't have any extra elements to it. You'll see that all these joints are nice and smooth and they don't have anything extra. When they start to have arthritic changes, the joint itself is swelling and the tendons and ligaments are starting to swell. So it's starting to try and heal itself at the same time. So it's bringing extra cells to the area to try and slow that process. So you'll start to see that the joint becomes knobby basically, but it also starts to grind on itself where it should have lots of cushioning to stay comfortable for the pet and they feel like moving their joint. But when you start to have these changes, they start to be really uncomfortable and maybe don't get up as quickly or want to go for as long of a walk because the joint is swollen and it's starting to affect the cartilage that's in those joints. So that being said, what can you do to help your pet whenever they're starting to have these problems? That's something that we can certainly talk about with your doctor. So what are some of the symptoms that you might see in your pet when they have arthritis or joint pain? Some of them can be very vague and not even make you think that they have joint pain. So oftentimes they will be limping, but not every time. Sometimes they'll be really slow to get up in the mornings when it's time for breakfast to go out for that potty break and you see them taking a few extra seconds to rise. They sometimes will be slower on their walks. They still want to go that distance, but you start to notice they're lagging behind or you might be pulling them along on the leash a little more. With kitties, you might notice that they're not getting up to play with their toys as much, or maybe they're not climbing as tall on their cat tree. Or those kitties that go outside, maybe they don't leave the porch as often and they're just hanging out in the shade, kind of waiting for you to bring them food. Sometimes when they are getting up, maybe they'll cry out, or they might cry out when you pick them up. And it isn't that you're necessarily hurting them, it's just that something is uncomfortable and they're trying to tell you that something doesn't feel right. These are the most common things that we see when it is an arthritis-related pain in these pets. So that's just something to keep in mind each day when you get up and you are petting your dog or petting your cat, or you're taking them for their walk in the afternoon, to see how they feel, see how slow they're going, or how quickly they're moving, or are they not posturing the same to go to the potty, things like that. Just things to keep in mind the next time you take them out to go for a walk. I don't want this to look like a product placement or advertisement for particular medications. I just want to show you that we have a large variety of options that we can talk about for pets that have arthritis. We have multimodal systems for how we like to make this work. So there are anti-inflammatories, which are designed to bring down the swelling and the inflammation around a joint. There are pain medications that are designed to help alleviate the pain that the nerves are feeling. And then there's also supplementation for the cartilage and the ligaments that you give to help support what cartilage they have left in these joints. So there are a lot of options out there that you can use as far as medications go to help support them as they progress with their arthritis. There's foods out there also that are recommended for joint supplement. There are some that are over the counter that you can look at, but there are prescription ones that work significantly better that are designed for the pets that either are very challenging to give medications to, or perhaps just medications isn't doing it and maybe they need something extra to get that extra fish oils and things like that in their diet. So lots of options abound with this. There are even formulations that come in an injectable kind that you give typically monthly or so that can help support cartilage growth and things like that. But all of these things work in conjunction with each other. Not just one of these medications is going to make things all better for your pet. So that's something to keep in mind when your doctor is talking to you about using anti-inflammatories and pain medications and joint supplements. It seems overwhelming, but at the same time, when you break it down into what each of these things does for your pet, it makes a little bit more sense for how we're making them feel more comfortable. So in the terms of dogs, about 80% of dogs having arthritis at the age of about 5 to 8 years. Does that mean that we necessarily need to start medications? No. Can we start joint supplements? Yes. Things that help support the cartilage that are in the joint already. We don't want to let that degrade. We can talk about just doing joint supplements. And then each year at your exam, talk about, have we progressed to the point of needing to start with a medication such as an anti-inflammatory or a pain medication. Kitties, you'll be surprised to know, almost 90% of them have arthritis by the age of about 10 or 11 years old. It's not as easy to diagnose in a kitty because they're very stoic and it's very stressful for them to be at the vet, and they don't want to tell us that things are painful. They mostly just want to get away from us. So we have to keep in mind for kitties, especially kitties who are indoor only that maybe don't move around as much, that their joints are going to stiffen pretty quickly, and we need to be mindful that they too are going to have arthritic changes in their body just because they're getting older and are sometimes overweight when they are starting to age. There are options for kitties out there as well. They are a little bit more challenging sometimes. My personal cats, I struggle to get medications in them every day. Even giving them something in their food is hard because they know it's in there and they don't want to eat it when they know it's in there. But it's still something that I try to do for them in order to keep them comfortable and knowing that I'm supporting at least a little bit of their joint health at this point. So what can you do to help your pet? Number one, talk to the doctor. Don't be afraid to talk to them and say, I think something is wrong. Trust me, we will believe you. You are the advocate for your pet and you're the one that knows them the best. You're going to see these things before we see it on an exam. So bring it up. Mention to them, hey, he doesn't want to go for a walk, or he cried the last time I picked him up. We will think about these things and we can talk to you about doing the different medications or supplements or foods to help your pet continue to be comfortable and stay with your family as long as possible.